So, just has some pain at the top of the foot here in this transverse tarsal arch area, right? And it was tender as I pushed up from the bottom,
right,
and less so as I pulled down from the top.
Yes.
So that's kind of exaggerating the direction of misalignment, and that's bringing it into that closer alignment. And the thing that was tender on the ankle was the inside portion right on the left foot, and nothing on that side.
No.
Okay. Anything on the outside portion?
A little bit.
A little bit, but more on the inside portion?
Yes.
Okay. So it seems to me, because of the limited ankle rocker, we call it, that this joint is rocked kind of forward towards me. So you're limited in how much motion you can get that way because you're kind of pointed in that way.
Right.
And is this the one that was sprained a couple months ago?
Yes.
Yeah. And what was the sprain? Was it an impact injury? It was a fall, wasn't it?
Yes.
Was it that big guy?
Yes, from behind.
Yeah, okay, yeah. I remember that story now. Okay. So we need to set that, and we also need to set this. We also see some limited big toe extension when we load it. So because this bone is the keystone for that archway, it's kind of like an arch in architecture.
Right.
And you have this keystone at the top that would support it. So this thing, however, is not a rigid structure, it's a flexible one, so it's an inverted keystone. So it should fall to allow for this to move. And when I plant that big toe, it should extend back, and it doesn't.
Right.
So when we lift this back up today, we should see that big toe extend, all right? This one, piece of cake, no problem, right? Because we don't have that same fixation in here. So let's go ahead and correct it. I'll have you flip over on your tummy for me if you would.
Okay.
Good. And then you feel the pressure on the back of the knee. Keep that soft for me, and then we'll make that. There we go. Okay, now flip back over for me. And we should see that the ankle rocker is better. Yeah, good. So that lines up perfectly. Let's see how the tenderness feels in here.
Much better.
Much better, good. And let's see how the big toe extends here. And we can see that springs just fine. Now we may not have fixed this portion yet, so how's that there?
Salty.
Yeah. So we're gonna bring that middle cuneiform down by bringing it here. Okay. And now if we go back into that one,
Much better.
much better, right? Cool. So everything works and moves like it should. There's no other fixation that I can feel in the ankle at all. So I think this is done. Single leg balance, right? While you're brushing your teeth and that kind of thing.
Yeah.
That'll help kind of turn these muscles on to retrain it a bit. I wonder, is there any pain on the back of the shin bone here in that muscle?
A little bit.
Okay, so that'd be another muscle to kind of work on. Another thing to do for home care.
Okay.
In addition to the balancing, is just kind of strip that muscle with your thumb.
Okay.
You can also pin it with your thumb and then just kind of move your ankle around through its range. And you'll feel that muscle pop up and touch your thumb. That's a good way to kind of pin and stretch, okay?
Sounds good.
Cool. Okay, so earlier we saw in Jess that she had a superior middle cuneiform. And so often we'll see inferior misalignments due to gravity, subluxation in the lower back, decrease in the nerve supply to these tissues, resulting in a collapse in the longitudinal as well as transverse tarsal arch. But in her case, she had a superior middle cuneiform, and my proposed mechanism was that she was stepped on when her foot was in a locked or closed pack position. So she was dancing at a bar, and a drunk guy came up behind her as she was in the toe-off position. So during the toe-off position, the windlass effect is in effect, and it raises that arch. And so since she was here and a guy came up behind her stumbling and hit her at the heel, it created a situation like that. Of course, I'm exaggerating that effect just for effect, but that would potentially put that into a superior position. So that's my proposed mechanism as to why we saw a superior middle cuneiform in that case, as opposed to an inferior misalignment, really in any of those bones from a trauma to the foot.